Committee will come to order. Welcome and thank you for joining us today for this hearing entitled Exploring State Options in SNAP. After brief opening remarks, members will receive testimony from our witnesses today and the hearing will be open to questions. In consultation with the ranking member and pursuant to Rule 11E, I want to make members of the subcommittee aware that members of the full committee may join us here today. Good morning and welcome to this morning's hearing on examining state options in the Supplemental Nutrition Assistance Program known as SNAP. Thank you to our witnesses for being here today and for sharing their expertise on this very important topic. Before getting to the main focus of today's hearing, I want to set the record straight on reforms to SNAP included in the Working Family Tax Bill, or H.R. 1, and dispel some of the false narratives I know we will hear in this room today. First and foremost, H.R. 1 protects and strengthens SNAP's ability to serve our most vulnerable neighbors in need. We are stopping federal and state executive overreach that has eroded once bipartisan work requirements for able-bodied adults without young children. We are finally creating real accountability incentives for states with high payment error rates, which I will remind everybody hurts the participants first and foremost. And we are protecting the hardworking American taxpayer who has been footing a $100 billion annual SNAP bill that increased by close to 70% in 5 years. No one in this room should be defending $10 billion a year in federal SNAP benefits going out the door incorrectly. Nor should they defend 40% of able-bodied adults without children on SNAP living under state waivers of work requirements without the economic conditions to warrant them. But this was the status quo before H.R. 1. The facts are that this program was on an unsustainable trajectory and H.R. 1 is putting it back on a better path. SNAP must be based on the goal of reaching nutrition independence, financial independence, and the American dream. I also need to address the ongoing fear-mongering by some of the leaders in my home state of Minnesota about the Working Families Tax Cuts bill and how they will affect and impact our counties. Minnesota, along with 9 other states, has chosen to administer SNAP at the county level. In fact, this is one of several state options that Congress allows. I want to be very clear and set the record straight. States are not required to push SNAP costs, neither administrative nor potential benefit cost, to the counties. In fact, in 6 of the 10 county-administered states, the state government shares the SNAP administrative expenses with the counties. In one state, the state covers the entire cost of the SNAP administrative expenses. So despite what local officials may be hearing from their governors, the states have a shared responsibility to prioritize and invest this critical nutrition program, and there is a precedent for it. This morning, I sent a letter to my governor, Governor Walz, urging him to re-examine his budget priorities, reducing the state's error rates, and taking accountability by restoring program integrity. Congress can no longer turn a blind eye to states that mismanage federal funds at the expense of vulnerable families. I would ask for unanimous consent to submit this letter for the record. I hope Governor Walz will work with me and other local officials to ensure Minnesota meets the intent of H.R. 1's historic reforms. But the primary topic before us today is much larger and far-reaching. While SNAP is a federal program, there are numerous state options, allowing states some flexibilities in operating their programs. As states implement the program changes included in H.R. 1, they will need to adapt and re-examine the SNAP options they have adopted to date. It's also important for us as legislators to regularly review the SNAP options currently allowable under federal law to know if changes or new flexibilities are warranted. I know some of our witnesses today will speak specifically to that. State options in SNAP are large in scope, impacting eligibility criteria, benefit levels, and even in what counties federal work requirements are in effect. It may come as a surprise to people that SNAP gross income and asset limits set in federal law are not actually the law in 44 states. This is something we need to address in this body. Now more than ever, states will need to carefully examine each state option, knowing how it will impact staffing, program costs, and most importantly, error rates. I look forward to learning more from each of our witnesses today about how states and counties are utilizing these program flexibilities, the impacts they have on administration and participation, and what things we should be thinking about as we look forward to the future of SNAP. Ms. Green, Mrs. Bivens, and Ms. Schmidt, thank you again for being here today. I understand Ms. Green and Ms. Schmidt have never testified before to Congress. We look forward to hearing from you today. With that, I'd like to now welcome the distinguished ranking member and gentlelady from Connecticut, Mrs. Hayes, for any opening remarks that she would like to give.
Thank you, Mr. Chairman. I want to first welcome our witnesses to the very first subcommittee hearing on nutrition and foreign agriculture in the 119th Congress. As the ranking member of this subcommittee, I came to Congress to work. I care very deeply about this issue of food security. And yet, 9 months into the year, 21 weeks into the session of Congress, and 9 weeks after the largest cut to food assistance in the history of our nation, we are finally here to explore state options in SNAP. Unfortunately, the problems our country faced 9 months ago have only been exacerbated by the reconciliation bill passed in July. I've noted that the chair referred to it as the Working Families Tax Cut Bill, or often H.R. 1. I don't know what any of those things are. But what I do know is that the, quote, one big beautiful bill that was passed by Republicans in July has already begun to hurt Americans. Americans are feeling the high food costs, higher rents, more expensive health care, child care, and energy costs. Republicans said that they are looking to address waste, fraud, and abuse. But their one big beautiful bill does nothing to address the actual fraud that is happening right now to SNAP recipients. Criminals are stealing EBT card information and taking food assistance away from those it was intended for. The bill does nothing to address the need to transition EBT cards to more secure chip cards to avoid this type of theft. And it does not address other critical issues within SNAP, like the need for college students to have access to these programs. Instead, 4 million people, including families with children, senior, veterans, and individuals with disability, will see the food assistance they need to afford groceries cut substantially or taken away entirely, thanks wholly in part to the One Big Beautiful Bill Act. I do not know if Republicans really understand that SNAP is county administered in 10 states and that most of those counties pay for some of all of the SNAP administrative costs for their states, which means that counties and states from Wisconsin to North Carolina will be struck by a massive bill starting next year that will have to get passed on to the taxpayers. Democrats want to address these issues. This bill does not do that. The issues that this bill is going to create are worse than and will only worsen and cannot be overstated. I hope we can try to find some real solutions to get out of this mess that has been made by the, quote, one big beautiful bill, and support states in their capacity to getting food to hungry Americans. State options are a critical way for states to tailor SNAP to their unique needs and the needs of the people they serve. I am concerned that SNAP eligibility and accessibility, now that states carry an enormous burden of the administrative and benefits costs shifts, will create additional burdens for individuals. Broad-based categorical eligibility, for example, is a state option that 45 states and territories, red states and blue states alike, use to ease SNAP benefit cliffs. It allows participants who get a slight raise at work or pick up an extra shift to continue to receive food assistance instead of getting kicked off of the program entirely and left with less money than before. It also allows SNAP households to save more than $3,000, the standard asset limit for SNAP, which is not even enough to cover first and last month's rent for most families in any part of this country. But because of the One Big Beautiful Bill Act, states might be forced to opt out, kicking working families off of the much-needed supports they need. And by helping this critical state option, kicking working families help by this critical state option off SNAP to pay for the costs pushed onto them. I look forward to this hearing today and to hearing from the witnesses about what state options are most helpful to them and the communities they represent, and how these options may be impacted by the immense financial strain that the One Big Beautiful Bill Act passed by Republicans in Congress this July have put on states and have put our states and counties under, and how they believe this issue should be addressed. I welcome your testimony today and hope that at the end of this hearing we can begin to not only illuminate, outline, but address not only the issue, but come up with some solutions. And with that, I yield back.
Thank you, Mrs. Hayes. I would now recognize my friend, the ranking member from Minnesota, Ranking Member Craig, for any opening comments you'd like to make.
Thank you, Mr. Fenstad. I suspect perhaps that one of the only things you and I are going to agree on today is Skull Vikings. So I will say that just at the start of this hearing this morning. Thank you for allowing me to start the conversation here today, and thank you to our fantastic ranking member of the subcommittee. Thank you to our witnesses in particular. This is the first subcommittee hearing of this Congress. You heard me right. The first subcommittee hearing on nutrition and foreign agriculture. Yes, there were no subcommittee hearings before my colleagues cut food assistance by $186 billion through the Republican budget earlier this year. And my colleague on the other side of the aisle just called it a name that I don't even recognize the bill. It wasn't the name of the bill. It's appropriate that we are serving on the Ag Committee, that I'm the ranking member of the Ag Committee, but you cannot put lipstick on that pig of a bill, and the American people know it. We cannot talk about state options without putting them in the broader context of that partisan process which resulted in a massive unfunded mandate onto states and counties, including in my home state of Minnesota. I met with Minnesota SNAP administrators here last week in D.C. Counties in my state are wondering how they'll successfully make the programmatic changes demanded by the Republican budget, while also cutting staff due to the major reduction in administrative funding. A reduced workforce also makes it harder to participate in state options that make program operations more effective and efficient. The combinations of added red tape and paperwork, program changes, and fewer staff create a perfect storm that will send states' error rate upward, putting states at risk of being fined millions of dollars by the federal government. In effect, Republicans cut their resources and then punish them when overworked staff make more errors administering an increasingly complicated program. None of these changes help reduce hunger in our communities. Seniors who rely on SNAP to stay healthy and live independently, parents who use SNAP to keep their children fed, veterans struggling while finding stable housing or employment who use SNAP to keep food on the table do not benefit from states being intentionally overwhelmed and under-resourced by a partisan budget that provides tax handouts to the already rich. Minnesota uses a number of options: standard utility allowances, a county-administered structure, and broad-based categorical eligibility, to name a few, to tailor the program to our state's needs, to help our neighbors and help keep our communities fed. Ohio recently joined Minnesota and the 44 other states using broad-based categorical eligibility. Last June, they opted in to, in their words, create a sliding scale that encourages people to earn more by slowly reducing their benefits as their income grows, providing an incentive to accept promotions and pay raises knowing that they won't immediately lose benefits. Lawmakers in Alaska also recently passed legislation opting into broad-based categorical eligibility, specifically to help with their error rate and speed up application review timelines. When this change went into effect a couple of months ago, an Alaska Department of Health spokesperson said it will, quote, result in faster, more streamlined eligibility determinations for many households, which will improve timeliness and reduce the risk of errors associated with incomplete or delayed documentation. State options are common sense policies that help SNAP reach those who the program was designed to help: people struggling to feed themselves and their families, the elderly, the disabled, veterans, and families with children. Exercising the options given to states to administer SNAP in ways that meet the needs of residents is not fraud, waste, or abuse. It is humane food assistance policy. The Republican budget has already made food more expensive for millions of Americans. Undermining or restricting state options will only serve to take food away from more people. We should be looking for ways to ensure SNAP remains available to every American when they need it, not making it harder and more expensive for states to administer it. Thank you again to the chairman and ranking member for having me join you today, and thank you to the witnesses for joining us in D.C., and I look forward to hearing your testimony. Thank you.
The chair would request that other members submit their opening statements for the record so the witnesses may begin their testimony and to ensure that there is ample time for questions. So I'm going to introduce the witnesses here. Our first witness today is Ms. Chloe Green, the Manager of Food and Nutrition Services at the American Public Human Services Association. Our next witness is Mrs. Joy Bivens, the Deputy County Administrator for Health and Human Services of Franklin County, Ohio. She is testifying on behalf of the National Association of Counties. And our final witness is Ms. Korin Schmidt, the Director of Wyoming Department of Family Services. Thank you all for being with us today. We'll now proceed with your testimony. You'll each have 5 minutes. The timer in front of you will count down to 0, at which point your time has expired. And just to give you a heads up, there's a few other committees going on right now, so you'll see members coming and going. Trust me, it's not you, it's us. And we'll be here as much as possible. So thank you all for being here, and we'll start with Ms. Green. Please begin when you're ready.
Chairman Finstad, Ranking Member Hayes, and distinguished members of the subcommittee, thank you for the opportunity to testify today on behalf of the American Public Human Services Association and to contribute to this important conversation on SNAP, a vital program serving more than 40 million people in our country each month. APHSA is the bipartisan nonprofit membership association that for over 90 years has represented state, county, and city human services agencies. Our members represent the executive leaders who report directly to their governors and the subject matter experts who oversee programs like SNAP, TANF, child welfare, and child care. We focus on building common ground and advancing pragmatic solutions that work both for the agencies that deliver the programs and the families who depend on them. In my role, I lead APHSA's work on SNAP and nutrition policy. I began this work during the onset of the COVID-19 pandemic and worked closely with state SNAP directors through both the emergency response and the unwinding. From that vantage point, I saw how SNAP can quickly adapt when states are given appropriate flexibilities and how powerful it is to have a strong federal foundation that protects families. SNAP is, by design, one of the most prescriptive federal programs we have. Congress sets the framework, USDA regulates it, and states must operate within those rules. Eligibility rules, benefit levels, and key components like quality control and payment error rate measurement are all federally defined. This uniformity is one of SNAP's greatest strengths. It guarantees fairness and ensures that families are eligible for the same benefits no matter where they live. At the same time, there are targeted areas where states do have options. These can be related to the application and how it's offered, certification periods and their length, verification and reporting requirements, the use of technology, automation, and staffing, and more. These flexibilities don't change the core rules, but they allow states to tailor how people experience the program and manage it in ways that meet their unique needs. Some options are relatively simple to uptake, like policy options that can be elected in a state plan. Others, like demonstration projects, are more complex, requiring rigorous evaluation, cost neutrality, and USDA approval. As an example, I'll use eligibility and benefit calculation because this illustrates both how prescriptive SNAP is and how flexibilities can operate. By federal law, every household must pass a gross income test, generally set at 130% of the federal poverty level, and then, after allowable deductions, such as housing, childcare, or medical costs, must also pass a net income below 100% of poverty. They must also fall under federal asset limits of $3,000 for most households or $4,500 for a household who has someone who's elderly or disabled. States must apply these thresholds uniformly, and they must provide the full federal benefit for every household that qualifies. What broad-based categorical eligibility, or BBCE, allows is for a state to raise that initial gross income threshold up to 200% of poverty and ease or remove the asset test. But it does not waive the federal net income requirement. Every household must still meet that final test before receiving a benefit. Flexibilities like BBCE can help families access needed benefits. It can be especially important for families with high living expenses and to help reduce churn, where families briefly lose and then regain eligibility. It also supports the successful transition off the program by allowing families to build savings. BBCE can increase error rates and caseloads but it also reduces burden and staffing needs for agencies. When states consider whether to use flexibilities like this, they weigh customer service, staffing capacity, available funding, and performance outcomes alongside direction for their governors and legislatures. Under the recently passed budget reconciliation bill, states will face increased matching requirements and financial penalties for error rates, creating new and complex considerations for them to weigh. Based on what we hear from our members, APHSA offers 4 recommendations for you to consider. The first is to support innovation and consider new flexibilities. Second is to make proven flexibilities permanent state options. Third, to balance accountability with flexibility. And fourth, to continue to engage directly with state and local leaders, like my fellow witnesses today, as we work to meet our shared goals. In closing, SNAP's strength lies in its strong federal framework paired with targeted state options to allow for innovation. By sustaining that balance, Congress can ensure SNAP continues to reduce hunger, improve nutrition, and strengthen families across our nation. Thank you again for your commitment to this vital program and for the opportunity to testify. I look forward to your questions.
Thank you, Ms. Green. With 4 seconds to spare, good job. I would like to now welcome Mrs. Bivens. Please begin when you're ready.
Good morning, and thank you, Chair Finstead, Ranking Member Hayes, and members of the subcommittee. Thank you for the opportunity to share today on the county perspective. My name is Joy Bivens, and I am the Deputy County Administrator for Health and Human Services in Franklin County, Ohio. Today, I'm here on behalf of the National Association of Counties, where I serve as Vice Chair of the Human Services Education Committee. In 10 states, counties administer the Supplemental Nutrition Assistance Program, determining eligibility, processing applications, and recertifications, and working closely with state and federal partners. In Franklin County, we serve more than 183,000 SNAP recipients, most of whom are children or older adults. Today, I'm here to share the county role in administering SNAP and to share recommendations for how we can work together to strengthen administration, maintain integrity, and improve outcomes. First, stable federal support and practical flexibility are essential to effective SNAP delivery. County-specific responsibilities vary by state law and by the design of state technology systems and policies. Where states permit counties greater operational flexibilities, counties have deployed innovation and improved outcomes. In 9 of the 10 county administered states, counties must partially or fully cover non-federal and administrative match. The One Big Beautiful Bill Act reduces the federal share of the match from 50% to 25%, beginning in fiscal year 27. In Franklin County, that would shift require approximately $7.5 million in additional local spending annually to maintain current service levels. This shift arrives as counties across the country face outdated technology, staffing challenges, and increasing pressure to improve timeliness and reduce payment errors. With stable funding and operational flexibility, counties can continue to deliver timely service without shifting unsustainable burdens on local taxpayers. Funding and flexibility are critical. However, proven administrative tools to help counties manage caseloads are also needed to protect program integrity. Broad-based categorical eligibility streamlines applications and recertifications for households already screened through the SNAP program, letting staff spend less time on processing applications. Broad-based categorical eligibility uses a sliding scale to ease the transition off benefits, ensuring working families don't have to choose between accepting a promotion and losing benefits or turning down a better-paying job to take food off the table. The standard utility allowance reduces documentation errors by allowing households to use the flat deduction rather than their fluctuating utility bills. However, recent changes limiting the use of the Low-Income Housing and Energy Program payments to qualify for utility allowance in households without an elderly or disabled member will increase administrative touch points and risk for documentation errors. At the same time, expansions to work requirements for able-bodied adults without dependent populations have dramatically increased monitoring obligations. In my home state of Ohio, we anticipate 17,000 veterans, former foster youth, and people experiencing homelessness will now be subject to work requirements. In order to meet these demands, counties need targeted support to recruit and train staff, which often need more than a year to fulfill proficiency. Alongside funding and administrative tools, counties also need policies that recognize local economic conditions and support participants as they enter the workforce. Counties rely on discretionary exemptions for ABOTs to mitigate churn for individuals facing temporary barriers such as homelessness or irregular work hours. Additionally, 8 out of the 10 county-administered states used ABOT time limit waivers for fiscal year 2025. Narrowing time limit waivers strictly to areas with unemployment above 10% removes flexibilities from communities facing underemployment, seasonal jobs, and changing markets. Counties believe that having the flexibility to use the indicators of insufficient jobs, not only the unemployment rate, will ensure that time limit policy fits real-world outcomes. At the same time, counties recognize that keeping individuals connected to food assistance is only part of the solution. Long-term stability comes when residents are able to move into steady, good-paying jobs. This is where SNAP employment and training and E&T plays a vital role. SNAP E&T gives counties a vehicle to help participants build skills, connect to work, but counties face hurdles with complex reimbursements and reporting requirements and expansion. By simplifying these processes, Congress and USDA can help counties add more providers in high-need areas and strengthen local workforce pipelines. Thank you.
Thank you, Mrs. Bivens. I would now like to welcome Ms. Schmidt. Please begin when you're ready.
Thank you, Mr. Chairman, Ranking Member Hayes, and distinguished subcommittee members. My name is Korin Schmidt, and I'm the Director of the Wyoming Department of Family Services. On behalf of Governor Mark Gordon and my staff, thank you very much for the opportunity to speak to you today. Addressing hunger is a priority for our state governor, in particular, First Lady Jenny Gordon. She's a tremendous advocate and has built a strong framework for community support and solutions to feed children and families. Wyoming's population is less than 600,000 people and is considered frontier. The majority of our counties have fewer than 6 people per square mile. This translates into large portions of our population living in low access areas and traveling 10 or more miles to a grocery store. In addition, Wyoming's aging population is growing at the fastest rate in the United States. And even though our younger population is rapidly declining, 1 in 5 Wyoming children are hungry. In our state, SNAP is an integral part of addressing hunger, keeping families together, and elderly people in their homes. Last fiscal year, a monthly average of 13,400 households, making less than $3,380 a month for a family of 4, received a typical food benefit of $386. Of the 28,000 individuals served, 44% were children, 35% were adults, 13% were 60-plus years or older, and 8% were ABODs, able bodies without dependents. Like other small conservative states, we have limited staff responsible for program administration, eligibility determination, and case management. Our SNAP team in the field consists of 92 workers in 28 local offices and 3 program managers who administer the 5 hunger-related programs. Our 12 staff in quality control and fraud protection are essential to maintaining the integrity and credibility of SNAP, whose ongoing support is strengthened by public trust. Given our minimal staffing and focus on cost-conscious governance, the payment error rate has been a primary performance indicator for decades and has been below 6% in the last since 2015. Constrained staffing and resources make us risk-averse, so we approach waiver and policy options with caution. The rate is susceptible to slight changes in policy and casework. Any deviation requires careful consideration. We vet opportunities through small pilot programs, research, and extensive conversations with other states. We look at lessons learned to assess the benefit and risks to program accuracy and integrity, then refined our eligibility processes to balance efficiency and accountability. We also attribute our successes to the strong partnership between our eligibility field workers and our program managers at the state level. The positive relationship between the caseworkers and the program managers allows for frequent and planned communication that promotes honesty and hard conversations. A focus on quality control and fraud detection is critical to maintaining ongoing public support for SNAP. We implemented front-end eligibility, which is a fraud detection tool used at the time of client application. Front-end eligibility allows us to investigate potential fraud before an application is approved and a benefit is issued, thereby avoiding the pay and chase model where we have to go back and collect. In the last 2 years, we've prevented almost $1 million in fraudulent benefit issuance. As states increase their financial contribution, please consider our ability to tailor program and policy changes to meet our needs. The current scope and regulatory structure of waivers and options do not give us the full ability to make sound economic choices on behalf of our clients and residents. For example, Wyoming is facing challenges with our rapidly growing elderly population that will not be able to generate income through work. Wyoming's low-income elderly would benefit from a waiver removing the asset limit for households receiving a Social Security benefit under a designated threshold. As mentioned, whenever policy changes occur, error rates often rise temporarily as eligibility workers adjust to new procedures. We believe a hold harmless period that begins after guidance is issued would allow error rates to stabilize and ensure appropriate and effective implementation. Last, we welcome a dialogue regarding meaningful outcomes that more accurately define a successful program. Error rates are a sound indicator of regulatory and programmatic compliance. However, it is also possible to define success as a family that, as a result of temporary participation in SNAP, achieves self-sufficiency through strong job training and education programs. Thank you again for the invitation and the opportunity to showcase Wyoming's hard work and successes, much of which is due to the hard work of our DFS family. Thank you.
Ladies, thank you for your testimony. At this time, members will be recognized for questions in order of seniority, alternating between majority and minority members, and in order of arrival for those who joined us after the hearing convened. You will be recognized for 5 minutes each in order to allow us to get as many questions as possible. I now recognize myself for 5 minutes, and I would like to submit for the record Section 10102 of H.R. 1, which clearly states that people that are medically certified as physically or mentally unfit for employment are not subject to the new work requirements. Ms. Schmidt, I'm going to start with you because you noted in your testimony that Wyoming looks to other states for lessons learned from adopting certain policy options and waivers. Can you give us specific examples of that?
Yes, Mr. Chairman. We have a strong network with other states in regard to a lot of conversations with our policy people. So, for example, it was suggested that we entertain a waiver that looks at client statements around assets and client statements around expenditures. As we discussed those options with other states, what we learned is that there are fewer errors surrounding those where we're just talking about assets, but that there was an increase in errors around resources. So through conversations about the pros and cons, implementation of the program, and what they saw as a result, we then therefore decided to go with just accepting statements on client resources, but not assets. That's an example of how we've really looked at the opportunities other states provide.
Okay, and you mentioned in your testimony that Wyoming implemented front-end fraud detection tools, front-end eligibility, and that has avoided close to $1 million in fraudulent SNAP benefit issuances in less than 3 years. Can you speak more about the tools that you're using, whether you know of other states that are using the same tools, and how much did it cost your state to implement this strategy?
Thank you, Mr. Chairman. The front-end eligibility tool we learned about at a conversation with fraud workers at a conference on welfare fraud. And the cost to start up was about $750,000. We applied for a grant through the USDA and the FNS, Food Nutrition Services. Ongoing costs, we think, are going to be about $200,000 or less per year. What we learned is that with a front-end investigator, when we have some suspicion that maybe reporting was fraudulent, we then refer it to a person who starts to investigate it from the very beginning before benefits are issued. That really helps to solve the problem of going after benefits if there has indeed been fraud committed. Not all referrals are fraud. Sometimes they're just mistakes in paperwork, but our review at the front end helps us to avoid that. And then if the person is eligible and has met all of the requirements, then they can go forward with the application.
So other than cost, did you have any barriers to adopting this strategy?
Mr. Chairman, some of the barriers were just uptake, we had to hire a few investigators on the front end. So finding, of course, in our state, those folks with experience to do that. We do now have someone who's been with the agency previously, retired, and so that was a nice natural fit. And then the asset verification that we use as part of the program.
Okay. Ms. Green, where do limitations exist on the use of technology and even artificial intelligence in SNAP, and how might better use of these tools improve both customer service for the person who needs the SNAP benefits and program integrity?
Thank you for the question. So our members that we've been hearing for years have a strong interest in better utilizing technology and automation to support their program administration, both to help streamline their work and so that really they can be making sure they're spending the most time on the cases that need it the most and streamlining cases that are more straightforward and simple. There has been some, although limited, guidance from USDA FNS around the use of automation, citing them as major changes required, which should, in practice, mean that a state can submit a request and then they be acknowledged and therefore approved by FNS, although we've heard from several of our members that there have been a lot of delays in response from USDA or a lot of questions that have delayed the implementation to be able to use automation. Additionally, USDA has defined automation or bots as non-merit staff, which then has additional limitations to what they can actually do in a SNAP case.
Ms. Bivens, I'm going to come to you for the same question. Limitations on the existing use of technology and artificial intelligence in SNAP. Do you have any comments on that subject?
Thank you, Mr. Chair. I would say that, because of our outdated technology system to even process the current cases that we have, we are still working to implement new systems, but unfortunately, those are costly. We look for opportunities to leverage technologies, not just to process cases, but to also save taxpayer dollars. But unfortunately, again, due to restricted budgets, it prohibits us from being able to look at what can be advanced and what is approved from our state partners in order to leverage new technologies. Because as you understand, we are a county administered state, and whatever Franklin County leverages to process cases, the entire state would have to adopt as well.
Okay. Ladies, thank you for your testimony, and I recognize Ms. Hayes, the ranking member, for 5 minutes.
Good morning. Thank you. I want to note again that there are several attempts made to rebrand this bill before states actually feel the impact of it. But what we are hearing and what people at home are experiencing is that the Republican One Big Beautiful Bill Act has increased the administrative cost share burden placed on states and counties operating SNAP from 50% to 75%. And you're going to have to figure out how to absorb that. The cost share will also apply to states interested in transitioning from the current outdated EBT card technology to EBT cards with chips. Chip cards are one of the best ways we can combat electronic fraud theft, which occurs when criminals skim or clone EBT cards and drain the accounts, leaving families who are depending on that food assistance with nothing. In Connecticut, nearly $6 million in food assistance has been stolen from more than 12,000 households in the past 2 years. Congress gave USDA the authority to reimburse those stolen benefits, so families whose assistance was stolen through no fault of their own would be made whole. However, despite it costing no additional dollars to extend, Elon Musk and the Republican majority in the One Big Beautiful Bill Act stripped that extension and that authority, along with many other bipartisan provisions in the end-of-year spending bill in 2024. Ever since, victims of these crimes have been told there is no help coming if their benefits were stolen. Ms. Bivens, have you seen instances of electronic benefits theft in Ohio? And if so, can you describe how families are impacted by the loss of their benefits and how the increased administrative cost share burden imposed by this bill impacts the ability of states to transition to safer, more secure cards?
Thank you, Ranking Member Hayes. And yes, we have seen this in Ohio. Initially, when it first occurred, we received hundreds of phone calls, and there was, support in order to reimburse. But there was a cutoff for those residents in order to receive the reimbursement for food. And since that has taken place, and there's no longer that support in place, if I can bring, for the empty chairs in the room, I look at the empty chairs and I think about the residents in Franklin County that receive SNAP and the ones that we're talking about right now. There's no help. So when they call, we're not able to assist them in order to, refuel their card. And what it has caused is it's a lot of frustration. We have grandparents that are taking care of grandchildren because of the kinship issue that we are experiencing right now. We have folks that are working that are underemployed that rely on their SNAP benefits so they can put food on the table. And when that EBT card is skimmed to no fault of their own, there is no relief that we are able to provide in order to assist them, other than they have to wait until the following month in order to receive their benefit. And so what has caused in Franklin County are more phone calls, more frustrated residents who are just trying to live and thrive every day.
Thank you. I've received similar calls in my office, and we went through all of the channels through state agencies, and the response was to have people reach out to local food banks, which their shelves are depleted because they lack the resources and are having to service more people. Ms. Schmidt, I heard you talk about the personnel and the people who actually help administer and educate people about these programs. In May, I introduced the SNAP Administrator Retention Act, which allows states to receive 100% of the administrative personnel costs associated with hiring and retaining merit staff who carry out SNAP programs. I heard you say you had to bring someone back out of retirement to help with this. Ms. Bivens, as the Deputy County Administrator, what would be some of the benefits of the federal government handling 100% of the administrative personnel costs so that these benefits can get out securely and effectively?
I'm sorry, can you repeat your question?
What would be the benefit of the federal government absorbing 100% of the administrative costs?
The benefit would be, it would release financial support in counties. We can leverage the dollars that we're assisting currently right now through workforce contracts, through supporting our nonprofits, in order to, connect folks who are receiving SNAP to more qualified programs. Currently, right now, as it stands, because there is a cost share, the dollars that are being leveraged in order to pay for the SNAP program, and even if it increases, what it will cause is, it will cause a decrease in our contractual services, meaning less dollars to our nonprofits to support our most vulnerable, less dollars in our food pantries, less dollars in our workforce programs. And we have high-quality workforce programs currently in Franklin County where folks are going through trade.
Ms. Bivens, I'm sorry, thank you. My time has expired. I don't
sorry.
mean to cut you off, but I have to get in before I end that the CBO estimates that 4 million individuals will be cut off SNAP as a result of the One Big Beautiful Bill Act that was passed in Congress. With that, I yield back.
Chair now recognizes Mr. Mann from Kansas for 5 minutes.
Thank you, Mr. Chairman. Thank you all for being here this morning. Thanks to Chairman Finstead for hosting today's hearing. I appreciate the opportunity we all have here today to discuss and examine the role that states and localities have in administering the SNAP program. The Farm Bill nutrition title accounts for an estimated 81% of Farm Bill spending in 2024, which makes it vital that this Congress actively conducts oversight and ensures the program is operating effectively. States and localities play a key role in administering the SNAP program on behalf of the federal government. While it's important to maintain this flexibility, there must also be accountability for high error rates that prevent benefits from being directed to our most vulnerable populations. I believe that everybody in this room shares the same goal, ensuring that SNAP benefits reach those who truly need them. If there are ways to make improvements to how states and localities are administering this program and ways to root out waste, fraud, and abuse, we should pursue these solutions and ensure that they are implemented effectively as Congress intended. I just have a handful of questions, and again, I appreciate all three of y'all being here this morning. First for you, Ms. Green, you mentioned in your testimony that using BBCE, states can confer SNAP eligibility to households who receive non-cash TANF benefits. From the USDA website, it looks like almost every state that uses BBCE considers brochures, pamphlets, 1-800 numbers as TANF benefits. How does this policy actually practically work? And do states simply hand someone a brochure that has been funded with TANF dollars and confer category SNAP eligibility, or is there more to it than that?
Thank you for the question, Representative. So in states, TANF is a block grant, so they can operate their TANF program differently as opposed to how SNAP is more prescriptive, as we have been talking about today. And so because of that, I can't tell you exactly how it works in every state, and I'm not working there on the ground. But I do know that what happens is, or what can happen is that when someone qualifies for a benefit, they can receive a pamphlet in the mail, for example, or in an office, and then if they go to apply for SNAP, they have to show that they have received that in order to then be able to use the BBCE benefits, such as above to 200% gross, or the increase or waiver of the asset limit.
Thank you. Next question for you, Ms. Schmidt. In your testimony, you spoke about bringing field and program leadership together every month, which is something that sounds like that you do. It seems like practically everyone should be doing that. But what have you discovered in these meetings, and can you point to improvements that wouldn't have happened otherwise?
Thank you, Mr. Chairman and Representative. The conversations get very technical, and it's through those technical conversations then that both the field and the program managers can understand maybe strategies that are going to be more appropriate. I think the relationship is important in that program managers don't assume through the regulatory scheme what they know is to be true. And also, I think from the field perspective, that not everything that is suggested to them is because we're being mean. So the relationship between the two, I think, really create the opportunity for brainstorming and very on-the-ground issues. So in a given community, if we see something that's popping up, it's kind of a heads up to the rest of the state and to leadership to start looking at it, and then strategies develop as a result.
I agree. Thank you. And last question for you, Ms. Green, back on you. In your testimony, you mentioned how Congress should support innovation if states are asked for funding to adopt automation and AI. How do you ensure that these investments actually reduce fraud and improve accuracy and efficiency instead of just sending a blank check?
Thank you for the question. I think, of course, and when I talk to members, it's always front and center that accuracy is essential to the program, and that there needs to be ongoing partnership with people like partners at the USDA to ensure that that's happening. In things like demonstration projects, when they're used, they do require rigorous evaluation for the state and separate quality control measurement of cases that are impacted to be able to measure things like fraud. Really, when I'm talking about supporting innovation, it's that states do want to try new things, but we need to not let perfect be the enemy of the good in preventing them from even trying new innovations because of how strict different requirements are.
Yeah, great. Well, thank you again for being here, and with that, Mr. Chairman, I yield back.
All right, I now recognize Ranking Member Craig for 5 minutes.
Thank you, Mr. Chairman. You know, what I've learned here in my short time in Congress is that everything that happens in those closed-door House conferences, whether it's the GOP or Democrats, it always leaks. And so what I'm noticing here this morning in the subcommittee hearing is really a reflection of what happened in a House GOP conference, where Lisa McClain is pushing my colleagues to hit the new, quote-unquote, working families messaging. Well, you know, I've just been sitting here brainstorming here all by myself. I would invite the rest of of America to help me brainstorm, but how about we rebrand some of this language to the wealth transfer from working families? How about we call it the higher health care costs for working families budget? How about we call it the more Minnesotans go hungry budget? You know, if we're going to rebrand the big ugly bill because they don't like the polling of Americans, every single one of us has a responsibility to make sure that every American knows what's actually in this bill. And what it is the largest transfer of wealth from working families in our country to the top 10% in our nation. And we cannot let anybody forget that fact, no matter how hard they try to rebrand. So, Mrs. Bivens, thank you so much for being here. And as you know, Ohio and my home state of Minnesota are two of the 10 states that opt to delegate administration of SNAP to their counties, right? Administration to the counties. Could you tell us a little about the benefits of running a county-administered SNAP program?
Thank you so much. Running a county-led SNAP program allows more accessibility for our residents who actually live in communities. Our current Job and Family Services are embedded in communities where residents actually live, and they have more accessibility. And what it allows for us to do is to make direct referrals to nonprofits, faith-based organizations, workforce partners, boots on the ground with residents having the direct opportunity to either walk into a building or intersect with us on one of our mobile units or also in one of our Wonder offerings.
You're bringing it straight to the communities. And so in 9 of the 10 county-administered states, counties pay for some or all of the non-federal share of administrative costs. Is that right? And can you share how much counties in Ohio are expected to contribute toward administrative costs? And how will the drop in reimbursement rate for administrative costs from 50 to 25% impact Franklin County and other counties that are in similar positions?
So with the change that is upon us, we are anticipating and increasing our share costs to an additional $7.5 million on top of what we already are expensing. And what that will do is, I will say that our Franklin County Commissioners are very generous and very forward-thinking in leveraging taxpayer dollars and leveraging sales tax dollars, I should say, to partner with nonprofits and workforce partners to find opportunities for higher wage jobs for residents. And so what do I mean? I mean that we invest in trade schools, we invest in CDL training, we invest in the livable wage jobs with those discretionary dollars that we're able to use. If we are to increase our shared cost, those dollars that we invest in those other opportunities, including the nonprofits, will diminish, and we will provide less offerings to the residents who are underemployed.
Yeah, it's just extraordinary, the impact on counties, and that doesn't even get to a state like mine where the cost shift is actually going to be to the counties. It's going to result in tax levies.
Yes.
My counties, it doesn't matter what side of the aisle my county commissioners are on, they're up in arms about this cost shift that the federal government is delivering to them. And in my home state of Minnesota, taxes are going to go up at the county level because of what my colleagues across the aisle have done here today. Let me get to my last question then. USDA has repeatedly said it would work with states and provide technical assistance as they work to implement the big, ugly bill. Yet I'm hearing from states that this hasn't been the case. In fact, last week, Pennsylvania sent a letter to the chairman stating that they have not received any technical support, that their pre-existing standing monthly calls have been canceled, et cetera. Has Ohio, Ms. Bivens, gotten the answers it needs to implement the provisions that went into effect 2 months ago?
I did speak to our Job and Family Services director prior to coming. They've had little contact in that regard. Unfortunately, we are still trying to understand the rules and implications of what is ahead of us.
Thank you for being here, and Mr. Chair, I yield back.
Thank you. I now recognize myself for 5 minutes. Ms. Schmidt, you note in your testimony that you only have 12 staff members in your SNAP Quality Control and Fraud Protection Unit. I often hear that staffing shortages prevent states from reducing their error rates. How has Wyoming managed to keep its error rate below 6% for 10 years with conservative staffing levels?
Thank you, Mr. Chairman. Our SNAP program has a very robust continuous quality improvement component to it. And so we are in this cycle of continuous quality improvement, which then allows us to efficiently use our QC fraud staff at their most. So it starts with robust data collection through our quality control program, in addition to the conversations that we have regularly with our field and our leadership. Based on all of that, we have a thorough understanding of what's happening with our program at any given time. We can see trends, we can look for problem spots, which then allows us through our quality control process to be able to identify what it is, the rate, the error rate, and then make the adjustments. So basically, we're efficient. Because we have a pretty consistent process to how we review our quality control information, it helps us then to identify fraud easier and then make the referrals as necessary. Also, the front-end eligibility component has really helped us along the lines with a limited staff.
Thank you for that. Mrs. Bivens, going down this road a little bit about specifically around the 10 states that administer the SNAP program at the county level. Do you think it's fair that decisions made by governors and state legislatures that increase the cost of SNAP, such as seeking work requirement waivers and expanding SNAP via BBCE, are forced on counties and they are expected to foot the bill?
And so if I can answer, Mr. Chairman, if I can answer it this way, I think that what we are ultimately dealing with are folks who are underemployed. SNAP is a tool, is an anti-hunger program, and unfortunately, folks are not making enough, and the cost of living has increased, housing has increased, and these costs are not incurred by the individuals who are impoverished. It's incurred by living. It's just this is where we're at in society. And so when asked if it's fair, I don't know if I can answer that, but I would say I don't think it's fair for rules to be implemented to individuals who are just trying to live every day, particularly children and senior citizens.
So just to be crystal clear, though, the governors and the state legislatures of these states are making the decisions to seek the waivers, but the counties then foot the bill to administer the programs.
And so I think collectively together that governors and counties need to work together in figuring out what is appropriate in order to ensure that large portions of our populations are thriving in our community.
Yeah, so thank you for that, and I'll just make it crystal clear. In Minnesota, that's not happening. The counties are not having a seat at the table. Specifically, when it comes to the waivers, they're always on the receiving end of the administrative costs, and they get what they get. Ms. Bevins, another question. As you know, if states are able to get their error rate below 6%, the benefit cost share would be $0. So given that all but one of the county administered SNAP states, including my home state of Minnesota, have payment error rates above 6%, how is NACO working with counties to get error rates down?
So we are working together with NACO. We have standing meetings similar to my colleague to the left. We have similar meetings where we can cross and share ideas on what is working and what is not working in our areas. The error rates are, as you know, for multiple reasons. It could be, user error, or it could also be, unfortunately, on a client error, not understanding what to submit or when to submit. So as we're working with NACO, we are working in exchanging ideas from some of our colleagues from across the nation on what we can adopt and deploy in Franklin County that will work to decrease our error rates.
Thank you for that. I appreciate your time this morning. I will now go to Mr. McGovern.
Thank you, Mr. Chairman. And given what's transpired in this Congress, I just feel like I need to say a few things. And I think states have no clue about what's about to hit them. And to my Republican friends, in July, you guys passed your big, ugly bill making the largest cut in history to America's anti-hunger programs. And now, 3 months later, now you want to hold your very first hearing of the Nutrition Subcommittee? I mean, really? Do you guys even realize how absurd that is? You're supposed to do the hearing before you pass the bill, not 3 months later after it is passed. And I don't know what you expect to learn today. You slashed the most important program that helps fight hunger. What do you think is going to happen? This Republican majority has become a giant rubber stamp for the rich. And that's what it's all about for you guys, giving another tax break to CEOs and billionaires. And what's unbelievable to me is that now you guys have the gall to come down here and try to lecture us about how states should be administering food assistance programs. You know what states have the worst hunger? Texas, Arkansas, Mississippi, Oklahoma. You know what these states have in common? They're led by Republicans. You know which state has one of the lowest hunger rates? My state, Massachusetts. California, Pennsylvania, Hawaii, Rhode Island, all places where hunger is lower, all led by Democratic governors. So if you want to talk about outcomes, check the scoreboard. And maybe focus on lowering hunger in your own states before lecturing us about how to administer food assistance in ours. And by the way, didn't Republicans used to claim they were for states' rights? States' rights, my foot. One of the reasons we do better in Massachusetts is because we take full advantage of a state option called categorical eligibility. It's a fancy term for the idea that working families shouldn't get punished for earning a few extra bucks or saving a little bit for an emergency when it comes to food assistance. Categorical eligibility makes sure SNAP is a bridge, not a trap. So if someone is working hard but is still struggling, making, say, $30,000 a year, they can still get some food assistance in Massachusetts. In Mississippi, that same person would be cut off at $20,000. You get no benefits in Mississippi. You'd have $20,000 a year to cover rent, utilities, health care, and food. And that is the recipe for keeping people in poverty. And I know you guys are obsessed with error rates because you want to imply that SNAP is a wasteful program. We hear it over and over and over again in this committee. But what about the error rates when it comes to the Pentagon? This week, Congress is advancing an NDAA bill that sends nearly $1 trillion to the Pentagon, and not a peep for most Republicans about sending $1 trillion to an agency that spends $1,500 for a coffee cup. But when it comes to food assistance for poor people, all of a sudden Republicans are up in arms about error rates. I mean, give me a break. And by the way, I'm glad someone from Wyoming is here to talk about how to reduce error rates. 200,000 more people live in my congressional district than in the entire state of Wyoming. And Wyoming spends $100 a person on administering SNAP. That's the most in the nation. So if the point of this hearing is to imply that other states should have the same error rate as Wyoming, you're going to need to double or triple how much this country spends on food assistance, not slash food assistance like you did in this big ugly bill. And you know what? With all due respect, the number I look at isn't just the error rate, it is the hunger rate. We live in the richest country in the world, and it is a moral outrage that we have hunger, and that's what we should be talking about in this hearing. And instead, you guys are using this excuse, again, to once again attack and demonize SNAP and to cover up how your big ugly bill is going to screw over poor people. Because of the big ugly bill, we're going backwards on hunger. We are going to have more families struggling to keep food in the fridge, more hungry kids, more red tape for working parents who are just trying to cook a healthy meal for their kids. And it's also that Republicans can hand another round of tax breaks to the CEOs and billionaires. It's a national disgrace, and instead of this hearing, we should be holding a hearing on how to end hunger. This subcommittee and this committee should lead that effort. Instead, Republicans are doing the opposite. Making SNAP better is something that we all a goal we all share. But that's not what this is about. I mean, we know what this is about. This is about demonizing a program that helps put food on the table for poor people. And quite frankly, the idea that we are not tackling the hunger issue, that we are making it worse, I think is a disgrace. And again, I thank the witnesses for being here, but I had to say for the record what really is going on here. And it's not about the integrity of the program. It's about cutting people off the program. I yield back.
And now recognize the gentleman from Oklahoma, Mr. Lucas, for 5 minutes.
Thank you, Mr. Chairman, and thank you to our witnesses for testifying today. Ms. Schmidt, Wyoming does an exemplary job of administering the SNAP program and has sustained an impressive error rate of less than 6% since 2015. In your testimony, you highlight the need to vet potential opportunities for SNAP expansions through small pilot programs and extensive conversations with other states. Can you share with the committee some of the lessons learned from these pilot programs and conversations with other states?
Thank you, Mr. Chairman. Representative, an example that I could give you is the on-demand interview waiver, and that is a waiver that we were just recently awarded. So as we were applying for this waiver, we did extensive review of the applications that were submitted by other states. And from there, then, we picked a handful of states that seemed to resemble and have experiences maybe similar to ours. We then started to reach out to those states and ask the questions about pre- and post-implementation. Did the waiver actually meet the need that was discussed in their application? Did it have the end result? And then through that, we made some decisions about implementation. And in this case, we did fully implement the waiver and expect to see good results, good returns on that result.
And how those lessons influence the way you administer SNAP in Wyoming? And pull your microphone just a little closer. I've ridden a farm tractor too much of my life.
Thank you. And I'm sorry, could you repeat the question?
And how have those lessons influenced the way you administer SNAP in Wyoming?
Representative, we are a small conservative state, and we are fairly risk adverse to trying new things because of the potential impact it can have on our error rates. The credibility of our SNAP program is integral to positive public support. So we spend a lot of attention thinking about how it is that the right people who are eligible for these services indeed receive these services. So it's a combination of wanting families, elderly people to have those services, in addition to recognizing that the eligibility process, the quality control process, and the fraud process are a big part of that. So that is what we look at when we look at options and waivers. And then that really does direct a lot of the decision-making from there on out. Sometimes we choose to move forward with a pilot and look at it as an option. Other times we've decided it doesn't work very well, and then we rescind the project.
Continuing with you, your testimony, and you mentioned this before, so let's expand on it. Your testimony indicates that due to limited staff, Wyoming tends to be more risk averse. You've noted that in changing the program. Can you walk us through the different factors your state considers before adopting a state policy option in SNAP, especially as it pertains to staffing and error rates?
Mr. Chairman, Representative, the very steps are actually part of our quality control process, and we're always understanding where our deficits are. Through the information that we gather, the data that we gather, we always see where maybe we need to shore up. And then we wait for opportunities that to come by, whether it's options, whether it's lessons learned from other states that maybe we could adopt to address that deficit. I think the foundation is that we always recognize what's happening within our program, and that is because we are small, and that is because we have a small staff. The conversations are a little bit easier had, and we have opportunities to connect more. As part of that, then, we look to the other states as we see options come through, and if it feels like it's going to be something that's going to help us address the deficit, then that's when we start to walk into it. So from the very get-go, we may disregard options that are available to us because we know that that's not going to be something that we can feasibly do while keeping an eye on our error rate and also understanding the sheer limitations of the number of staff. There's only so much our staff can do.
Mr. Chairman, before I yield back, I'd simply like to note I appreciate the director from Wyoming because being able to demonstrate projects and test changes before implementing how you ensure a well-run program, the way it should be. With that, I yield back. Thank you.
I now recognize the gentlewoman from North Carolina, Ms. Adams.
Thank you very much, Mr. Chairman, and thank you all for being here. SNAP payment error rates refer to the percentage of benefit payments that are issued incorrectly, whether it's overpayments, whether underpayments, or administrative errors. And a 10% error rate actually means that the program is getting it right 90% of the time, reflecting a relatively strong track record in administering benefits accurately. But this one big ugly bill made it so that states with 10% error rates face extremely high cost share penalties. That said, I still have critical questions that remain unanswered. For example, what happens if a state cannot afford its new required share of SNAP benefit costs under the recent law? This was a key concern that I raised in July, in a July 1st letter, but we have yet to receive clarity on the potential consequences or the solutions. Meanwhile, grocery prices continue to rise, putting increasing strain on families who are already living paycheck to paycheck, despite a White House commitment from day one to address these rising costs. Republicans have instead chosen to cut SNAP benefits, and I want to say significantly so. These cuts will reduce the amount families will have to spend on groceries, and that's going to make it harder to afford basic necessities. Reduced benefits mean less spending at SNAP retailers, which negatively affects farmers and food distributors and local economies, especially in rural areas and small towns. Mr. Chair, I ask for unanimous consent to submit my July letter into the record. Like North Carolina, Ohio, and many other states operate under biennial state budgets, meaning their budget cycles are 2 years long, not annual. And this creates major challenges. States are being asked to budget now for costs that they won't even know until October 2027. Combined with other new cost share responsibilities from Medicaid cuts in the One Big Ugly Bill, it puts states in an impossible position. You know, I've served for 20 years in the North Carolina House, and I know firsthand that states cannot afford budget cuts under these conditions, and they simply can't afford these new burdens. So, Ms. Bivens, since you administer SNAP in a state with a biennial budget cycle, what concerns does this raise for you?
Thank you so much. As it states today, if we were to impose our error rates, we will be paying $300 million.
Wow.
We are working currently right now, of course, our error rate has gone down, and we work closely with our state partners in trying to innovate, but the burden would be critical. It would debilitate our human services branch in order to assist our residents.
So Ms. Green, what feedback have you heard from these states regarding budgeting for these new cost shares and uncertain future costs?
Thank you for the question. Throughout the past several months when this was being discussed, and then since it's been passed, we have heard significant concerns from our members across the country about their ability to, for their states to be able to fill the shifts that have been shifted to them for costs on SNAP. Of course, that includes both the administrative shift as well as the potential for paying part of the benefit, which states have never had to do before. I do also want to say, because you've been talking about payment error rates, that fiscal year 26 starts in less than 30 days, and that could define up to the first 2 years of a state's cost share, and states are still working on and waiting for the rest of the guidance from USDA to be able to implement the changes, which could impact their error rates as well.
Thank you very much. Mr. Chairman, I did ask to have my letter submitted. Okay, great. Thank you. And I'm going to yield my time to Ms. Hayes.
Thank you for the time. I just asked for unanimous consent to introduce a Wyoming Public Radio transcript article into the record. The article is entitled, quote, "Here's what changes to SNAP mean for Wyoming," end quote. And in it, Korin, who is the senior administrator for the Department of Family Services, is quoted as saying, "We either get the money or the SNAP program goes away," end quote. So even in Wyoming, there's concern about the lack of federal resources coming to the state in order to continue these programs and administer them. Thank you. With that, I yield back. I ask for unanimous consent.
Without objection.
Thank you.
All right, we'll go to the gentlewoman from Illinois, Representative Miller.
Thank you, Mr. Chairman, for hosting this hearing and for providing the much-needed oversight of SNAP. As a mom, grandma, and farmer, I know how important food security is to all hardworking families. But I'm concerned about how liberal policies have damaged SNAP, all at the expense of the honest Americans and all at the expense of my constituents in Illinois. For example, When states allow illegal aliens to join SNAP to essentially steal money from the American people, that is a major abuse of the program, and one, thankfully, that will soon end. I worked with this committee to make sure that language was included in reconciliation that would remove unlawful illegal aliens from SNAP. But this is only one small step in the right direction. Overall, the abuse is staggering. Since 2022, more than $21 million in benefits have been stolen from Illinois families. Illinois has one of the highest error rates in the country. This is a failure due to poor state management. SNAP was also designed to be a nutrition program, not a junk food subsidy. That means Congress must ask, how do we ensure SNAP dollars are safeguarded for American families, not stolen and abused by radical state governors or spent on junk food? Ms. Schmidt, Wyoming has a reputation for tight accountability in the SNAP program. From your experience running a state agency, what role should Congress play in ensuring that states are held accountable so families don't pay the price for mismanagement?
Mr. Chairman, Representative, thank you for the question. The eligibility, as you mentioned, is established by the feds in the federal government, and then the states then enforce those. The method that we've chosen to enforce it is to ask for verification proof, a birth certificate, for example, and then we verify that through the Department of Homeland Security's SAVE system. So we have both electronic ways of verification and then physical ways of verification.
That's fantastic. Also, Ms. Schmidt, as someone who has had to manage eligibility determinations at the state level, what steps should Congress make to make sure SNAP benefits go to American families first and that states cannot use loopholes like Illinois is using? They don't require the driver's license or a birth certificate to extend benefits to those who should not qualify.
Mr. Chairman and Representative, you know, in part of my written testimony, I made a comment about how every state has to make the decisions based on its constituency. And Wyoming makes a lot of our decisions based on what it is that will be supported both through our public and through our leadership. And so as we think about what it is that we would need then in order to make sure that we are performing the best, one of the big requests would be is consistent information coming from our partners at FNS and the USDA. And I think that consistency in terms of conversations across all states helps anyone who's applying for SNAP to know what it is that is expected, what they need to verify. And then as people move, as they do from state to state, then they have a greater chance of being successful in making a sound and legitimate application. So technical assistance, consistent technical assistance across our partners and across our states, I think would be one way that the government could help us.
Well, I appreciate that you've been a success story that we can look to. And also, in my remaining time, would you like to respond to Chairman Hayes' comment about the radio program cutting SNAP in your state?
Mr. Chairman, thank you. The reality is that there has been a reduction in the administrative support from the federal government. We've talked about that today. We've gone from, in the state, from 50% of the cost to 75% of the cost. Of course, that's going to mean an increase in state general fund, in our case, to support the program. We're on a biennial budget as well. Our legislature will be convening in February to discuss the governor's budget that will be presented to the legislature in late November, early December. And then I see from there a conversation, a very local conversation about the merits of SNAP, who it serves, and what the impact that program has. It makes it now a very local conversation. But at the end, there is still a reality that there will be some responsibility of Wyoming to pick up some of the tab.
It's a new day here, and American taxpayer benefits are going to be going to Americans. Thank you.
I'll now recognize the gentlewoman from Oregon, Ms. Salinas.
Thank you to Chair Finstead and Ranking Member Hayes for convening us, and thank you to our witnesses for being here today. Roughly 740,000 Oregonians, or 1 in 6 residents, rely on SNAP to keep themselves and their families from going hungry, and that includes at least 100,000 just in my district. Nearly 9 in 10 Oregon households that receive SNAP also depend on Medicaid. And we all know that under H.R. 1, the big ugly bill, my Republican colleagues at the direction of President Trump have explicitly targeted these folks. The sweeping cuts to health care and nutrition programs in this legislation will devastate those who are already struggling the most. One of the most harmful aspects of this bill is how it changes the partnership, as we've been talking about today, between states and SNAP. States already face tight budgets, and this legislation forces them to absorb enormous new costs. I know my state of Oregon is facing really tight budgets with the tariffs and the drop in economic activity. The burden could be so great that states may have no choice but to scale back SNAP benefits. And to be frank, I suspect that shifting these costs to states was designed to have exactly that effect. So, Ms. Green, according to state data, Oregon expects to take on about $75 million in new administrative costs each year because the one big ugly bill reduces the federal share of SNAP administrative costs from 50% to 25%. And if the state also fails to meet the bill's strict error rate requirements, that $75 million could be compounded by upwards of $250 million in annual benefit costs. Given these pressures, how likely is it that states, especially those already facing budget shortfalls, will be forced to reduce benefits to balance their budgets?
Thank you for the question. Our understanding of the legislation right now is that states have to pay the full benefit amount that a household is eligible for. And therefore, absent any legislative change, states wouldn't be able to, for example, only pay 85% of the benefit to avoid the state share. So because of that, our understanding is that either states have to make up that share or they will not be able to operate a SNAP program.
At all?
That is our current understanding.
Thank you. Do you anticipate that this steep administrative cost share could actually make it harder for states to improve their error rates, which I believe is what we are trying to get at here, since staff reductions or other cuts may actually undermine program integrity?
Yes, so what we hear from our members is that reducing payment error rates is not one easy step to be able to do that. It's really a whole of system approach to it. And some of the most important things there are the training of staff, which of course take money, and system changes and upgrades and new resources such as income verification tools. All of these, again, take significant funding. We have seen in the past, for example, actually in Oregon, who was in financial penalty because of having a significantly high error rate for 2 years in a row, has now, they used the option to reinvest half of their penalty amount and have significantly dropped their error rate in the past year, I think because of the breadth of different approaches that they're looking at. And again, being able to use that dedicated funding to improve that.
Thank you. And I know we've talked about this today too, but one of the most important flexibilities the states have in administering SNAP is the ability to waive work requirements for able-bodied adults without dependence in areas with high unemployment. Before the passage of the one big ugly bill, states had discretion to grant waivers either for areas with unemployment above 10% or for areas lacking sufficient jobs to provide employment for individuals. Oftentimes, these are in rural areas. The big ugly bill eliminates that flexibility by restricting waivers solely to areas with unemployment above 10%. This year in 2025, Oregon is using these waivers in 30 counties, 30 of our 36 counties and 7 tribal areas. Collectively, these communities have unemployment rates at least 20% higher than the national average. Ms. Bivens, given some of these indicators, do you believe restricting waivers only to areas with unemployment above 10% undermines our ability to respond quickly and effectively during downturns?
Yes, I do, and thank you so much. I think that currently right now in Franklin County, our unemployment rate, the last time I checked, it was 5.1%. We don't have a a 10% error rate. And that is very narrow for a lot of counties across the country. And so just that indicator alone is very restrictive.
Thank you. I yield back.
Thank you. I'll now recognize the gentleman from North Carolina, Mr. Harris.
Thank you, Mr. Chairman, and thanks to all of you on the panel for your time today and your willingness to come and share. My colleagues today seem to be defending a status quo of expensive policies that aren't ultimately helping hungry Americans. Record high payment error rates, food assistance to illegal aliens and working capable adults, and using loopholes to qualify people for government assistance. But what my colleagues fail to recognize is that the reforms in H.R. 1 that was passed actually, in fact, preserve benefits for the truly needy who Congress intended for SNAP to serve. Now, my home state of North Carolina is unique in the way it administers SNAP benefits. Each of our 100 counties oversees the program rather than a state office. And this model of administration has been singled out today in some of the testimony, and I want to set the record straight for my constituents back home. Ms. Bivens, a question for you, just yes or no. Does H.R. 1 explicitly require that states push the cost of SNAP over to individual counties? Just yes or no? Yes, ma'am.
No.
No. Well, and thank you for clarifying that for the record. States have never been required to pass SNAP cost on to counties, and H.R. 1 did not change that whatsoever. So I find it incredibly misleading when my colleagues on the other side of the aisle claim that counties are going to bear the cost of this legislation. And as your testimony points out, in 6 out of the 10 county-administered states, the state shares the SNAP administrative expenses with the counties. And in 41 states, counties bear no cost. Now, it's true that the federal government will be contributing less to SNAP now, and that the difference in cost will have to come from somewhere, but it's not a one-for-one swap. And when states and counties implement H.R. 1's reforms, they will find that SNAP will be stronger and help the very people it was designed to assist. So that is why I object to the idea that counties in my district will be left out to dry as a result of this legislation. And frankly, I call on the governor and other state leaders in North Carolina to work with counties and ensure that the resources to meet the needs of their SNAP participants are done and the law is followed. Real quick, just a second question in the remainder of my time. Ms. Schmidt, Congress has a duty to ensure that federal taxpayer dollars are being used responsibly by the states. And this is especially true when it comes to SNAP and the effects that payment error rates have on federal resources. And that's why, frankly, I'm very proud of the reconciliation bill's reforms to SNAP, as it holds the states accountable for the operations of its SNAP programs, while at the same time protecting the program for those it is designed to protect. In reading in the testimony that you submitted, Ms. Schmidt, you mentioned in your testimony that you manage a, quote, basic SNAP program in Wyoming. Can you just expand on what you mean by that and how that has contributed to your state's low payment error rate?
Mr. Chairman, Representative, the reference to a basic program really comes down to the minimal options and waivers that we pursue. Also in my testimony, I noted that any type of implementation of an option or a waiver can be disruptive to the practices in the field, and then therefore are felt then in our error rate. So when I say minimal, I really do mean that we, as I've testified here earlier, we really do try to pinpoint what the problem is that we're trying to solve, and then implement the appropriate option or waiver or solution based on that. That is the best way for us to be able to administer within our means, so to speak. We do not have the luxury of a lot of staff to be able to be as innovative as I think maybe we would like to be. But the reality is that we operate a constrained program.
Well, it sounds like Wyoming's SNAP program, while it may be basic when compared to other states, actually is working better than most other programs. And it seems to me that this is somewhat of a good model that other states should follow. And again, I'm grateful for all of you on the panel. I'm grateful for your time and your willingness to come and share with us today. And with that, Mr. Chairman, I yield back.
Thank you. The chair now recognizes the gentlewoman from Hawaii, Ms. Takuda, for 5 minutes.
Thank you, Mr. Chair. Let's be very clear, whether the counties are bearing the burden or the states at the end of the day, it's no different. People are about to go hungry. This new day that we see dawning means that over 4 million people in this country will go without less food on their table. In my home state, we're talking about 50% of those SNAP households being children. Children that can't go to work and support themselves to put food on that table right now. So I just want to be really clear and follow up on my colleague's previous question. Ms. Green, you stated that if states have to, if they can't make up the shortfall, I think you said, then this program will close. Explain what you mean by that. What happens, very clearly in plain English, what happens if states can't make up the shortfall?
Thank you, Representative Takuda. Absent any change to the current legislation, our understanding is that if states cannot pay the funding that has been shifted to them, they will not be able to operate a SNAP program.
Okay, so when you say they can't operate the SNAP program, what does that mean for beneficiaries?
It means that SNAP, as it currently is, would no longer be offered in the state, so no one would receive SNAP as it currently is in the state.
Okay, so there's some catastrophic potential ramifications from this bill, is what you're. If a state program closes, that doesn't mean you're just cutting off some benefits to a few people. They will not have that EBT card to go to the grocer to be able to pick up food for their family.
Yes, as we currently understand it. Again, we are still waiting for USDA FNS interpretation, and of course, there could be changes to the law, but currently that is how we understand it.
Now, I know it's a small state, similar to Wyoming. No matter what, you are going to have significant ripple effects. We do live in food deserts. Food deserts, by the way, cost a whole lot more money. Sometimes even, the cost to administer a program costs a whole lot more money. So we're talking about shifting 75% of administrative cost burden now to the states. And likely, depending on your air rate, 5% or more of that state cost share for the program. As you look at the broad reach of states, especially perhaps larger states, but especially I'm concerned about rural America that bears the higher burden in terms of the number of SNAP households that exist in our community. How many states could be potentially looking at this catastrophic ending of the SNAP program, taking away of EBT cards from families that need it most? Any thoughts on who can make up that balance? And I'd like you to keep in mind, or anyone can answer this, the fact that we're not just talking about SNAP here. We cut over $1 trillion from Medicaid. We cut a lot of other support services that states are now going to have to figure out, do I pay for someone to have food on the table, which food is medicine, or do I help to restore or provide some level of health care, especially, again, let's think about rural and remote America, but let's also think about urban America that has a high density, high demand, high need. So are states going to really, how many states are really going to be able to look at covering all these costs versus taking away, as you said, those EBT cards, closing those programs? And we heard those words as well from the transcript that Ranking Member Hayes has put into the record. Closing the program, the SNAP program. Anyone want to take a shot at that?
Thank you. I would add, as you're talking about, there are multiple changes, and really when we talk to our members, especially in executive levels and their state agencies, that they will have to be looking at the budget impacts, not just from SNAP, but also with Medicaid. Also, when there were proposals, for example, to cut LIHEAP or other programs within human services. We also know that the eligibility workers, for example, on these programs, in many states operate or work on, SNAP, TANF, Medicaid, and more. So we don't view any of these in a silo, so I appreciate you in raising that. I also want to clarify, because there are two different, large cost shifts that we're talking about, one being the admin costs in increasing the state share to 75%, which is, of course, a very important change, as well as really the benefits being what we see as the biggest challenge that states would be looking at into whether or not they can operate the program, because that could be, as some examples were shared, hundreds of millions of dollars in a year per state.
And I just want to add, I know I'm running out of time, Mr. Chair, but food security is everywhere. As I mentioned, 1 in 6 in my district, the households are food insecure. Even in Wyoming, especially small states, food insecure actually rose to 15.5%, as you know, in 2023. Our national average is 13.5%. Take a look when you walk outside. Over 1 in 10 people right now cannot put food on the table, and we're about to see catastrophic loss if states cannot make up their cost share and these admin costs. Thank you, Mr. Chair. I yield back.
Thank you. I now recognize the gentleman from Wisconsin, Mr. Van Orden.
Thank you, Mr. Chairman. Hey, just want to establish some bona fides here. I was raised in abject rural poverty by a single mother, and we had food stamps when it was actually a stamp that you put on a card when you went to the grocery store. I subsidized school lunches, government cheese, the whole thing. And I volunteered to be on the subcommittee for 2 Congresses in a row, and if I get reelected, I'm going to be on this subcommittee for 3 Congresses in a row, because these programs have merit. And this is one of the things that we can actually unite together with. Like, I don't know if the hell is going to freeze over, but I actually agree with Mr. McGovern on a lot of these things, and I agree with my Democrat colleagues. Like, there should be chips for EBT cards so they can't get skimmed. You know what I mean? And these programs should be as widely available as possible to the people that are in need, not just widely available. And we're talking about having illegal aliens on these programs. SNAP is not a global program. It's a program paid for by American citizens for American citizens, and I think that we can agree on that. And I think that's wonderful. But there's room for improvement. And the error rates, the initial idea was to charge every state 25% for error rates, and I strenuously objected to that, and we got it focused in a tiered system to focus on the individual states' error rates. And the purpose of that is not to remove people from the programs. The purpose of that is to encourage responsible bureaucracy, and that can be done. And people are starting to feel the heat, and they're focusing on this. So check this out. The state of Wisconsin spends $38.52 per month to administer this program. Now, Ohio, on the other hand, spends $97 per month per person to administer these programs. So that's twice as much. So, Ms. Bivens, can you explain to me the difference? Why would it cost $97 in the state of Ohio to administer these programs when it costs $38 in the state of Wisconsin?
Thank you, sir. I would say for several reasons. In order to, as you know, because you're familiar with Ohio, and I can talk about Franklin County, we're a county of 1.3 million people.
Sure.
We have about 183,000 folks that are receiving SNAP.
Yeah.
It requires a staff person to be trained to administer, to do all the things in order to ensure that that resident has what they need regarding their EBT card. In addition to what I will say is, and I'm not familiar with the cost of living in your state, so I apologize.
All right.
Cost of living across the country has increased.
Okay, so Ms. Bivens, the cost of living has absolutely nothing to do with the administration of
So-
the program. So hold on a sec now. Let's go. We're going to go back to Wisconsin. Mr. Chairman, I request unanimous consent to enter this little bit of paperwork I got in the record.
Without objection.
All right, so check this out. Here's the state of Wisconsin. And we are one of the most efficient states in the entire country. They're spending $4.4 million to issue EBT cards, $1.8 million for quality control, $200,000 for management evaluation, $4.5 million for fraud control. We can agree, those are all great things. Now check this out. They're spending $7.3 million. This is under the leadership of Tony Evers, or actually his chief of staff in an auto pen. They're spending $7.3 million for automated data processing development. If it's automatic, why is it still costing $7.3 million? They're spending $42 million for automated data processing operations. If it's automated, why is the state of Wisconsin spending $42 million for an automated process? The purpose of automating things is to make them much more efficient, less expensive. $1.3 million for fair hearings. I get that. Now check this one out. The state of Wisconsin, under Tony Evers, chief of staff in the auto pen, is spending $43.2 million for SNAP employment and training programs. So SNAP employment and training programs are part of SNAP. And they're hiding this under administrative costs. Now extrapolate that across the entire nation. We're talking about hundreds of millions, if not billions of dollars that are being misallocated. And I was the hungry child when I went to sleep. And I don't want it, and neither do my Democrat colleagues. We don't want a single child to go to bed hungry in the United States of America. But when we're spending 11.122378364, we're spending over $11 billion for administrative costs. That's what we need to nip in the bud, so that money goes to the hungry child. And that's what we're trying to get at. There's no viciousness here. We want every single person who needs food assistance in this country to receive it. And that's why we are so adamant about getting rid of stuff like this. That's why we want the state of Ohio to spend $38 a month administering this program, vice $97. And my time has expired. Mr. Chairman, I yield back.
Thank you. I now
Mr.
recognize
Chairman?
the
Excuse me.
gentleman from...
Mr. Chairman? Can
yes.
we ask the gentleman to share with us what the document was?
Oh, yeah,
We
I'm
just
sorry.
shared that it was pieces of paper. I don't know if you typed that. What is the document?
Mr. Chairman, can I
I
respond?
speak Wisconsin, so I knew what he was saying, but
Yeah.
go ahead.
So, Madam Ranking Member, what this is, it comes from the Wisconsin Department of Human Services, and it is their grid provided to us as far as the breakdown of the administrative costs. So, Mr. Chairman, I ask you unanimous consent if I can enter into the record the paperwork from the Wisconsin Department of Human Services that details out the administrative costs of the SNAP program.
Thank you.
You're welcome, ma'am, and thank you for clarifying that.
All right, I now recognize the gentleman from Alabama, Mr. Figurs, for 5 minutes.
Thank you, Mr. Chairman. And let the record reflect that Mr. Van Orden has agreed to work with us to get the chip cards in place, and so we are going to do that. I think that's common sense. It's something that's costing real money. It's really costing real money and having negative effects. I represent 2nd Congressional District in Alabama. It's one of the poorest congressional districts in this country. About a 1 in 4 rate of SNAP participation in my district, and as several of my colleagues have pointed out, that under the reconciliation bill, they have said that the people that need the aid the most will still get it. But I want to be clear with what we have in our possession in terms of knowledge right now about what happens if a state cannot meet the cost-sharing participation, that those people can no longer get it. And so this conversation has shifted totally away from limiting eligibility to certain people to eliminating the program for everyone. That's my understanding of it. And Ms. Green, I know you've answered this question already, but is that your understanding of what happens here if a state cannot meet the benefit cost sharing?
Yes, as currently written, if a state cannot meet the benefit cost sharing and the admin cost sharing, that they would not be able to operate a SNAP program.
Ms. Bivens, is that your understanding? And Ms. Schmidt, is that your understanding? I know we heard some, or we saw Ranking Member Hayes enter something into the record, a statement on behalf of, I believe, the same organization, the same agency that you work with, but is that your understanding?
Yes, sir, that's our understanding.
So to be clear, to be crystal clear, what this bill did was create the potential for SNAP programs to no longer exist in any shape, form, or fashion in terms of providing SNAP benefits in states that could not afford to or chose not to, for whatever reason, meet the cost sharing. Is that a fair assessment of that, Ms. Green?
Yes, sir.
Ms. Bivens?
Yes, it is.
Ms. Schmidt?
Yes, sir.
I almost just want to sit in silence to let that sink in. The United States of America just signed into law a bill that will allow states, essentially, to determine whether or not they will provide food assistance to anyone, to federally funded food assistance to anyone. That would include children. Is that correct, Ms. Bivens?
Absolutely.
That would include disabled individuals. Is that correct, Ms. Green?
Yes, if they no longer operated a program.
That would include homeless veterans. Is that the case, Ms. Schmidt? Or would there be some exemption for them?
That's our understanding, yes.
That's a sad day. That's a sad day when we sit here and look at that. And in my district, you know, in my state, $172 million would be Alabama's cost sharing requirement, given our most recent error rate of 8.5%, which is something that we need to reassess how that's calculated, because that is not a fair assessment of actual errors. But this bill made no changes that I'm aware of. Please feel free to correct me if I'm wrong in terms of how error rates are calculated. Is that correct, Ms. Green?
Yes.
Ms. Bivens? Is that your understanding as well, Ms. Schmidt?
Yes, sir.
So I had some questions that my staff prepared for me, and I thank you, Kyla, for doing that. But as I sat through this hearing and the realities of, you know, some of the commentary that's being made and some of the statements and positions that people have been taking, I felt the need to highlight the realities, the stark realities of what this bill potentially means in states that, you know, that do not meet the cost sharing. I think we all share the general objective and the hope and the moral value, I would like to think, that we should be feeding hungry families, hungry people, and also creating pathways for them to come off food assistance. I'm not one that believes poor people want to be poor. But I felt the need to highlight that. So I thank you guys for your response, and I yield the balance of my time to the ranking member.
Thank you. I would just like to enter into the record from the USDA Food and Nutrition Services, the SNAP State Activity Report for FY 2023. And according to this latest data in FY 2023, Ohio's administrative costs per case were $33.31, not the $90 that was previously stated in this hearing.
Without objection.
Thank you. I yield back.
I now recognize the gentleman from Wisconsin, Mr. Weed, for 5 minutes.
Thank you. I want to thank Chairman Finstad and Ranking Member Hayes for holding this hearing today. While quite a bit of the rhetoric surrounding today's topic may have you think otherwise, I think all of us on this subcommittee do agree that SNAP and hunger prevention is important, and that it is even more important that the people who really need the support can get it. With that in mind, I think we can also agree that with all our states' unique needs and interests, it's an overall good thing that each state has the opportunity to customize their SNAP program. However, it is clear that those options have also moved the program away from what Congress has intended. Additionally, I think it has become abundantly clear that some states want to make the program their own, which I think can be a good thing, but they also want the federal government to foot the bill completely. Take my home state, for example. Since the passage of the Working Families Tax Plan, I have heard from the Democrats of my state that we can't afford the changes that the bill made to the program. However, last year, NPR reported that the state had quite the budget surplus, $4.6 billion to be exact. So I would challenge the governor of my state of Wisconsin, Tony Evers, to really prioritize this program the way that he claims to and utilize those funds for that purpose. Like with every other government assistance program, the state should contribute to the benefits, especially if they want to customize SNAP beyond what the federal law prescribes. So, Ms. Green, can you walk through how each state determines which options that they will utilize? Is it the governors, the state legislature, a mixture of both, or is it something else entirely?
Yes, and thank you so much for this question, because if I can, I'd like to also just go back to what we were just talking about, and that I do think when we're talking about state options, there is still room to look at policy flexibility beyond what's currently allowed in law to make it more feasible for a state to continue operating a program and to look at their eligibility so that they could make it more affordable for the cost share. So I am glad that we're talking about policy options and flexibilities today, and the future potential for where we can continue to look at flexibilities in partnership with state agencies. So to your question around how do states decide this, it really is, it can differ across states and across what the issue is. So sometimes again, a policy option. The agency can see that as a priority and raise that to their commissioner and have the governor sign off. Sometimes they need to have that approved by a board at the state. And then sometimes it's actually passed by their state legislature to require them to use it. So for example, in some state legislatures, they are required to use BBCE, which we talked about earlier, so that would require a law change. Some also require them, for example, not to be able to use discretionary waivers, which are another work requirement waiver within ABOD. So it really does differ.
All right, thank you. Ms. Schmidt, you paint the picture of a state that operates a lean but incredibly efficient program. Can you explain how Wyoming determines which flexibilities to use without overwhelmingly raising the cost to operate that program?
Mr. Chairman, Representative, yes, we start with what is going to help us, and then we analyze whether it'll in fact help us or hurt us. So essentially what we do is we look at what issues are happening within our program, whether that be around case processing, whether that's around how we organize our work, and then we look for the options that may best fit or wait for an option to show up that could support us. So it's really founded in the data that we gather through quality control and through feedback from our clients and also from our field staff, and recognizing what is it that may be of best use for us to be able to first be effective and efficient, but also to deliver what we need to deliver, and that's a benefit. So starting with quality control, we then work through problem identification. Then from problem identification, we look at what strategies are available. Then we address those strategies and determine what of those strategies are going to be most appropriate. Do they affect our error rate? That's a consideration we give. Are they politically feasible and palatable with our constituency? That's another factor that we'll consider. And then we'll start with slow research, investigation, and then potentially implementation on a pilot level if we think that that's an appropriate solution.
All right, thank you, all three of you, for being here for this very important hearing. Mr. Chairman, I yield back.
Thank you. I now recognize Mr. Carvajal from California for 5 minutes.
Thank you, Mr. Chair, and thank you to all the witnesses for being here today. Ms. Bivens, I represent the Central Coast of California, and before I came to the Congress, I served on the Board of Supervisors for 12 years. As a county supervisor, I got to see firsthand the fiscal challenges counties face, particularly regarding administrative cost burdens as it relates to SNAP. In your testimony, you described how the recently enacted One Big Beautiful Bill, which I call Ugly Bill, could create additional financial strain on counties instead of easing it. As you know, California, along with 9 other states, delegated administration of SNAP to its counties, which serve over 34% of SNAP recipients nationwide. With the new requirements under this bill, counties will likely face increased responsibilities. Given that counties already shoulder a large share of the non-federal administrative costs, could you elaborate on how this bill's incoming financial burden will impact local county resources and the administration of SNAP services?
Thank you so much for the question. So the way that this bill has been written, although it is not, 100% cost from federal government, every county and every community around this country is dealing with some form of fiscal issue. Counties and communities currently right now rely on tax dollars as well as sales tax dollars. If this were to go in place for our county alone, it would be an additional $7 million. And we would have to make cuts in other areas in order to support residents in our community. And that will be around the country. And how that would impact the administration of the SNAP benefit, we would have to make some tough decisions on how we would even administer it if we're going to incur additional more dollars in order to administer. And as you know, it takes a very long time to train a staff person, at least a year to be proficient, so there's always going to be errors because it's not error-proof. And so, what this could possibly do to communities and counties is it would lean our budgets And then we would have to make decisions on where other areas do we cut, and then what are those areas, how does that impact the residents in our communities?
So in essence, it's shifting cost burdens to states and local communities.
Absolutely.
Ms. Bivens, when SNAP benefits are reduced, families oftentimes turn to other local support to make ends meet. Can you describe how cuts to SNAP in counties like your own could impact other services like childcare, housing assistance, and workforce development, and what that strain looks like for a county budget, which you've already done? But if you could elaborate just a tad more, that'd be great.
Currently, right now, when we look at our SNAP residents, they are experiencing what we know to be are either underemployed, they're not making enough. And so it is because of high housing costs. It is because of high child care costs. It is because of all the inflation and cost of living, the reason why folks depend on SNAP benefits. And so if this, particularly if we were just to hypothetically say, let's say it goes away in Franklin County, or if it's weakened in Franklin County, our state legislator, we decreased our food pantry budget by $7 million. So there's not enough food on the pantries in order to even support the decrease in the SNAP changes if we were to be extreme and to administer in a different way or to have it go away.
Thank you. A lot has been said about fraud and efficiency by this administration. And if you really wanted to do that, the big, beautiful, ugly bill would have really addressed that. And it does little to address that issue. We've heard about the rise in EBT card skimming, which leaves families without food assistance they rely on. From your perspective at the county level, what state options or federal flexibilities would be most effective in helping prevent fraud while ensuring families can securely access their SNAP benefits?
And so from the county perspective, of course, we've talked about it before, the CHIPS, leveraging the CHIP option, and also looking at the EBT card, no different than we look at our credit cards or our debit cards from financial institutions. Those securities that we put around those cards, many of us receive alerts when we're in other communities that are not familiar with our financial institutions. So looking at ways we can be more sophisticated or catch up with current day society as it relates to fiscal financial institutions in order to trigger and target fraud when they are stolen.
And Ms. Bivens, I'm running out of time, but does the big, beautiful, ugly bill address that in any way,
No, it
shape, or
does
form?
not.
Thank you very much. Mr. Chairman, I'm out of time. I yield back.
Now recognize the gentleman from Indiana, Mr. Baird, for 5 minutes.
Thank you, Mr. Chairman and Ranking Member, and I appreciate this hearing about exploring state options in SNAP. And so in that vein, I appreciate all of you witnesses being here and sharing your ideas. And so I'm going to start with Ms. Schmidt. You mentioned that in order to combat fraud, your team implemented front-end eligibility, FEE. Could you elaborate on the structure of this tool and how it helps investigate potential fraud? And could you additionally explain the difference between this and what you referred to as the pay and chase model?
Mr. Chairman, Representative, thank you. We first learned about the front-end eligibility at the United Council on Welfare Fraud Conference. And when we learned about this particular project, we applied to FNS, the USDA FNS, for a fraud framework grant. And this was back in August of 2022. We were issued $750,000 in the initial grant. And the biggest part of the grant was used for asset verification. The original period of the grant was from August of 2022 through September 24, but because we got a late start, we extended it until March of 2025. So our grant just ended this last spring. We will continue this grant because we did find that it prevented a lot of what you mentioned, which is the pay and chase. So essentially, without the grant, we would make a payment, we would issue a benefit, then to discover it was fraudulent, and then have to pursue actions in order to retrieve those dollars. It is inefficient for us. It's not a good use of our small staff. to have to go chase down, but rather looking at potential fraud at the beginning of the case and then making the decision about whether or not that case should be considered for benefits. Not all information that we receive is fraudulently provided. Oftentimes, as was testified earlier, it's a client making a mistake, a misunderstanding on what they thought the question was. So it's also a good way to provide technical assistance to our staff to help them to be able to ask the questions a little bit more targeted or correctly so that we can avoid fraud from the very get-go. It's a prevention approach more so than it is a reactive approach.
Thank you, and I like the idea of prevention instead of having to try to recover those dollars, so I commend you for that, taking that program to take a look at it. In another area, Ms. Green, I want to ask you, artificial intelligence is really taking off, and it's of interest to me how we might use that. So do you know of any states that use advanced technology to improve efficiency? What are the biggest barriers that states face in making technological advancements and investments? And how can we help them on the federal level?
Thank you for the question, Representative Baird. So our members are also really excited about the potential of using AI or artificial intelligence in SNAP, especially when they continue to share about challenges with staffing and turnover and really looking at it as an opportunity to help make up for that capacity. Although, of course, it does take funding and investment into high quality technology, including for things like user testing to make sure it works well on the front end. So to answer the second part of your question first, where some examples are, the examples actually right now are pretty limited because, as I had mentioned earlier, from our perspective and what we hear a lot from our members is that the USDA Food and Nutrition Service has been pretty reticent to approve abilities to use automation or AI. And there has been some framework, but really what our members would like to see is some more direct guidance or guide rails on what they can apply for and to work with them to really make it happen. Where we do see some use is around what non-merit staff can do, so things like if they call into the call center, IVR or integrated voice response can help direct them or help answer some of their questions. I know that NACO has shared about this happening in some counties as well, and some starting to use in their policy manuals or things like OCR, where you can help to translate a printed document into computer text.
Well, Mr. Chairman, I got more questions, but I see my time's up, so I yield back. Thank you.
All right, thank you. I'll now recognize the gentleman from Illinois, Mr. Jackson, for 5 minutes.
Thank you so much, Chairman. Thank you, our ranking member, Mrs. Hayes. Let me begin by first acknowledging and thanking all the participants for your testimony and your time today to share with us, and also acknowledge the irony before us. We sit here in the Agriculture Committee, and specifically the Subcommittee on Nutrition, and yet we have before us a sweeping bill that has already become law that has bypassed our deliberate body and our ability to even weigh in on this discussion. There have been no hearings, no testimony, no fact-finding. This is simply has been legislation by branding. This bill tells us that it will lift families into dignity through expanded work requirements. But consider the single mother of 2 in Illinois, where the law is clear. Children under 14 may not legally be left alone. The eligibility for students to stay and children to stay at home varies state by state. We come from very diverse states and very diverse backgrounds. Children under 14 may not stay at home alone. Therefore, every additional shift that mother is asked to take, mandated by this bill federally, is simultaneously prohibited by our state in Illinois. Isn't this not a level of contradiction, a demand that she cannot meet, that is impossible? The contradiction is very real. The minimum age for children in Illinois is 14. They need parent supervision. Parents with younger children cannot comply with expanded work requirements unless affordable child care is made available. This bill does not provide any such funding. In effect, it creates a catch-22. Meet the federal requirement and violate state law, or honor state law and you violate the federal SNAP eligibility. This is not empowerment, this is entrapment. And finally, the ultimate paradox is the federal government, in its pursuit of dignity, inadvertently criminalizes the very act of parenting. Mothers are told to work longer hours. The state says, stay at home with your children. What is a mother supposed to do? In the state of Illinois, we have 1.9 million persons that are eligible for SNAP. Under this reduction in the 50% cost sharing now to 25%, that's going to be an additional $1 billion passed on to our state. We're going to see families go hungry. And lastly is regarding the seniors. I think it's cruel. I put an amendment to try to curtail this eligibility requirement for the senior citizens, people having to work 60, 70 years of age almost in order to qualify for these benefits. And considering that you have more frequent recertifications, online-only submissions, some people don't have access to the internet, there are tighter deadlines, this is a disaster. I want to thank each of you, and I would ask Ms. Bivens, do you think this bill will be practical and enhance its desired goal of feeding more hungry children and seniors in our society?
I do not. I think that thank you for the question. I do not. I think it will require more collective conversation, inclusive conversation from all the systems that you mentioned prior in order for it to be effective.
Thank you so much. Mrs. Green, in your state, can you contrast or compare what we're going to confront with Illinois on having to have parents stay at home with children at 14? What will be the state's workaround of that federal law?
Thank you for the question. Speaking on behalf of the country as a national association, I'm not as familiar with individual state laws in terms of whether parents can stay home or not, but I do hear your concern around the additional challenge for states that do have laws like that, and the challenge that the mother or anyone in that case would have to weigh.
Ms. Schmidt, can you comment on that, on what would be the mother's workaround on complying with state and federal law that's at a contradiction?
Mr. Chairman, Representative, Wyoming doesn't have a required law around a minimal age. We really look at the appropriateness of the child, the circumstances. But to your point, it asks the question about childcare and the role of childcare, which for us and our agency is a core foundational program that supports a lot of this work. So we've taken a very family approach to the work in our agency and have kind of set our standard around home. Why home matters is our tagline. And from that, we try to orient all of our programs to think about what is necessary from a collaboration across programs and through communities to support families so children can stay safely at home or elderly can stay safely at home. So it's through those conversations that we would address this problem. It's about what is available locally through our churches, through our community supports to provide that support to that mother, looking at programs that are designed specifically around employment for mothers and providing childcare as a response to that so that that child can be safe. We also very much consider kinship and looking to family supports as an option to what we would see in that event.
Thank you. My time has expired. I'd like to thank each of you. I wish I could have met you in a hearing and gathered more testimony. Thank you, Mr. Chairman. I yield back.
Thank you. I'll recognize the gentlewoman from Ohio, Ms. Brown, for 5 minutes.
Thank you, Chairman Finstad and Ranking Member Hayes. Thank you to our witnesses for being here today, and a special thank you to Ms. Schmidt and Ms. Bivens, who are truly on the front lines making sure families in Wyoming and Ohio can put food on the table. What we've heard today is deeply troubling. The fallout from the one big ugly bill that my Republican colleagues are desperately trying to rebrand after forcing it through this summer, only to realize it is worse than we feared. Let's be clear. This bill was never about program integrity or rooting out waste, fraud, and abuse. It was about shifting costs onto states so Republicans could hand out more tax cuts to wealthy and the well-connected. The bill rigs the system by inflating error rates in SNAP, essentially punishing states and counties for paperwork mistakes, not fraud. Then, to add insult to injury, it slashes the very administrative funding that Ohio needs to hire and retain staff who process applications, correct errors, and serve families. That means caseworkers in places like Cuyahoga County, who already manage the highest caseloads in the state, will be asked to do more with less while facing penalties for mistakes that are inevitable under these conditions. And families across Cleveland will pay the price with longer wait times, more red tape, and fewer resources making it to people who need them. So I want to start off first with you, Ms. Bivens, and thank you again for all that you do for Ohio. Since Ohio is a county-administered SNAP state, we're in a uniquely challenging position. These new costs won't just fall to the state, they'll fall directly on individual counties. In your testimony, you noted that counties have very limited options for generating revenue, relying mostly on property taxes or sales tax. Unfortunately, many now expect they'll have to raise taxes just to keep up. Can you speak to what the immediate impact of these cuts would be on counties and families? And also, second, if these cuts were delayed, how much breathing room would it give the counties to plan ahead and soften the blow?
Thank you so much for your question, and I really appreciate the service that you provide to Ohio, so thank you. Previous to what I stated earlier, these cuts, Franklin County rely heavily on sales tax. And as you know, residents across the country are taxed out, from property taxes to all types of taxes. So for us, if we were to incur this shared cost, Franklin County has to make a decision on what we do not fund anymore. And what does that look like? So it would be tremendous, and it would be debilitating to our human service delivery system.
And so you also mentioned that you would have to come up with roughly $7.5 million a year to cover the new SNAP administrative costs, and that's not even accounting for the increased cost share that is coming as well. This is a massive number, and counties just don't have unlimited budgets. I used to work at the county, so I know. Ms. Bivens, what other critical services could be at risk if that money has to be diverted? Workforce training, child care services, public health, can you tell us?
So it would be workforce training. It could be currently right now we're running a pilot to subsidize child care for those who fall into the benefits cliff, and we're able to leverage general fund dollars in order to do that and we braided some of those dollars with ARPA in the past. It could also be funding our nonprofit organizations who support us in providing quality training for folks who need training in order to be skilled up for a better paying job. So, it's almost like whack-a-mole, if I can use that term. I know that's not a professional term, but if it's almost like whack-a-mole, and you pay you steal from Peter to pay Paul, or whatever the terminology is. But we would defund a lot of supportive services for our residents and making those decisions in order to figure out how we move forward.
I thank you for your testimony and again for the work that you're doing. Here's the bottom line. These cuts aren't just line items on the budget sheet. They are lifelines. They represent families who have fallen on hard times, families who will now have to wait longer for help on their SNAP application. Families will get caught in red tape because there aren't enough caseworkers to process their paperwork, and families who will lose out on services because counties have to shift dollars away from things like workforce training or public health. At the end of the day, these cuts don't make SNAP more efficient. They just make it harder for families in Ohio to put food on the table. And with that, Mr. Chairman, I yield back.
Thank you. Before we adjourn today, I'd now like to invite the ranking member to share any closing comments that she may have.
Thank you. And I want to thank our witnesses for being here today and for highlighting challenges that state agencies and counties face when administering SNAP, and informing our committee about the importance of state options, which provide agencies with the flexibility to tailor their services to meet the needs of their communities best. More needs to be done to support families, children, veterans, and other vulnerable populations in our communities. It is even more apparent today that the recent cuts to SNAP in the One Big Beautiful Bill Act will create more problems than they solve. 4 million Americans will lose some or all of their SNAP assistance as a direct result of the One Big Beautiful Bill. So much here today was discussed about error rates. I wish we had taken time to really talk about the 80 to 90% success rates that most states have experienced over the last decade. Based on CBO estimates, the Center for Budget and Policy Priorities estimated that about 1 million children will see food assistance to their families cut substantially or terminated under expanded work requirements, elimination of eligibility for many lawfully present immigrants, and other benefit cuts. States and counties will be forced to raise taxes, cut funding or other social service programs, or possibly stop participating in the program at all. Ms. Schmidt, you said you'll have to have some local conversations. That translates to locally, people will have to figure out how to pay for these services. There is no other way around it. States will be left to make hard decisions, even ending SNAP altogether because of the legislation passed by this Congress. The increased administrative cost share and benefit cost shifts will make it more difficult for states to implement options that streamline application processes and improve customer services. These are real people in my district, in every congressional district across the country, who will be left with fewer resources to make ends meet. I'm talking about our veterans, our seniors, our parents, those working 2 jobs to put food on the table, or those who just need a little bit of help, supplemental help. They were left behind in the One Big Beautiful Bill. What remains are the problems like benefit cliffs and SNAP skimming, and no solutions to these problems was included in this legislation. But I remain committed to improving SNAP for the 42 million Americans who simply need a little help putting food on their table. And in case it needs to be said, I spent my career as a classroom teacher. If a child, a 15-year-old child, let's say 15, I chose that age intentionally, came to my class and they were hungry, their documentation doesn't matter. Do I have a problem with my taxpayer dollars being spent to feed a child? In case it needs to be said, the answer is no. And I will fight to make sure that every child in this country, no matter their status, goes to bed with a full stomach. We have the ability to do it. Hunger is a policy choice, and we have demonstrated that over and over and over again. The permanent tax cuts that were given to the wealthiest individuals in this country could have fed countless families in our nation. I'm still here. I'm ready to work on these issues. I'm ready to find solutions. I'm ready to ensure that we are lowering food insecurity and childhood hunger, and I am at the table and remain committed to doing these things all day, every day, over and over and over again. But when legislation is crafted that talks about the 8% of individuals who are considered able-bodied, or the handful of people who have defrauded the system, and refuses to acknowledge the success of the SNAP program in addressing hunger in this country and making sure that people are healthy and can show up in their communities at work and at school and just thrive and be productive, something that we have the ability to assist in, I can't participate in that. So again, thank you for our witnesses for coming. I've been waiting 9 months for you, but happy that you're here. And please reach out to my office if there's anything that we can do to help just come up with ways to craft legislation to begin to address some of the things that you spoke about here today. Thank you, and with that, I yield back.
Thank you. Thank you to all the witnesses for being here today. This has been an important discussion about how to move forward and meet the intentions of H.R. 1's historic reforms. I also want to remind everyone that federal spending on SNAP has increased by over 70% since 2019, while food insecurity rates have remained stagnant. The status quo isn't working. Republicans are committed to addressing the root problems struggling Americans face, which is why we want to refocus on work and ensure work requirements are robust. After the passage of H.R. 1, we have the opportunity to serve folks on this program better, to remove some burdens from the taxpayers and get people off SNAP into independent futures. I want to again thank you all for being here and your testimony today. Moving on here, under the rules of the committee, the record of today's hearing will remain open for 10 calendar days to receive additional material and supplementary written responses from the witnesses to any questions posed by a member. This hearing of the Subcommittee on Nutrition and Foreign Agriculture is now adjourned.